Hello everyone, this is Bekir Fatih Meral, Department of Special Education from Sakarya University in Turkey. Today I'm gonna talk about physical activity and benefits of the physical activities for children with autism spectrum disorder. Um, this project, especially the intellectual disability, but physical activity is really important for children with autism spectrum disorder as well. So I reserved a separate video for this. Let me share my slide and then we can continue together. Again, this is the European Union project, be part of the European Union project. Yeah, after this presentation will be about definition and characteristic of autism spectrum disorder and importance of physical activity in education and the quality of life children with ASD. After you watch this video or well studies this video, whenever you like to, you can watch this video. I hope so. You will explain some characteristics or features of the autism spectrum disorder or some diagnosis criteria. Also, you can find the many articles about the autism spectrum disorder as well. Also, I hope so. Again, you can explain how to physical activity, how is let me, I'm sorry, it's too much to you will you will you will explain the importance of the physical activities, their education, also their quality of life. Autism spectrum disorder or autism, it's very famous. Maybe among 14 disability categories, one of the most famous disability categories. I really don't know. Maybe social media, maybe some movies like Rain Man or Temple Grandin, or some mystery about those kids with autism spectrum disorder. Really famous the diagnostic groups. But unfortunately, they need this special education and should be taken to some special measurement and the behavioral strategies has to be followed for those kids. At the same time, maybe they need a specific dietary regimen for your healthy and the sleep routine. Also, especially they need to physical activity, doing the physical activities. So some programs, some special designed, specially tailored for those children with ASD. Some program, that can be followed, can be should follow. Today, first of all, I wanna explain or give the definition of the autism spectrum disorder, and then dealing with the physical activities. I will talk about another issues too. Autism spectrum disorder is a neurodevelopmental and increasingly prevalent disorder, currently affecting the one in a 54 children. This reports this prevalence rate depending on the American Minister of Health, Center of Disease Control and Prevention. I saw recently this prevalence, higher than these numbers, but maybe we can keep it. Individual with ASD experience substantial deficits in social communication and social interaction problems besides the restrictive repetitive patterns of behavior, interest, or activities. This is the DSM-5 definition. Yes, autism is a complex neurobiological developmental disorders that is the typical diagnosis in childhood, especially early childhood period, before the three years old. But affect the lifespan on the lifelong of the human. So it's not a disease, can be recovered, or there is a specific there. We cannot say that there is a specific treatment, to remove the autism from the anybody's life. Unfortunately, there is no any treatment. So effectively, whole lives. The hallmark characteristic of autism include an impaired ability to communicate and relate to all others socially, and the restricted range of activities, repetitive behaviors, for example, the unmeaningful, the motor movements, or we call the echolalia, the diggle, diggle, diggle, bab, bab, bab, that, something like that, there is no any purpose of dealing with the communication, the just repeating the sound on or murmuring, and they sometimes has these specific routines or some obstructive behaviors, unfortunately. While the causes of autism are unknown, some professionals say it's genetic based, but they have been still working to to well understand what exactly causes of the autism spectrum disorder. Unfortunately, preventative measures or uh, before the birth, any assessment to diagnose the autism not yet occurred. We don't have. Uh, Actually, there's a if we call an effective therapy or treatment, we have just the behavioral strategies, namely special education introduction. So as soon as possible, early diagnosis, also early childhood education is so important for kids with autism spectrum disorder. Let me show you a video. Change the mind share screen, can watch some characteristic of disorder. Oh, I'm sorry.
Açıkçası İngilizce benim için hep
Unfortunately, there are so many advertisements. Yeah, fortunately, I found the video. Yeah, let's watch the video together. We can see some features, some characteristics of autism spectrum disorder.
Autism is a neurological developmental condition, which means our brains develop differently, some parts faster and some parts slower. Autism affects every person differently. If you've met one person on the spectrum, you've met one person on the spectrum. It seems everything I do is either too much or not enough, or both. Gifts in one area may come with serious challenges in another. Autism is not a linear scale. This is one of the biggest misconceptions. We are not more or less autistic, higher or lower functioning. We are autistic in different ways and each have different support needs. The ASD levels 1, 2, and 3 refer to the level of support a person needs, not their ability to function if this support is in place. My special interests mean that I see the world differently. My sensory sensitivities mean I feel the world differently. And the way I think and process information means I connect with the world differently. From a young age, society teaches us that difference is bad, and so for survival, we learn to hide our true selves. Masking, camouflaging, passing. When we appear normal on the outside, it's not because we have ceased to be autistic, it's because we no longer allow you to see it. Having some autistic traits does not make you a little bit autistic, any more than being sad from time to time makes you a little bit clinically depressed. Equating the two invalidates my experience of trying my whole life to explain my difference to others and not being believed. Autistic people are not the same as each other. What binds us together is the shared experience of being the odd one out. We are every age, every gender, every culture, every profession. Knowing I'm autistic tells you only one thing, that I do not fit into a box. Therefore, all your assumptions must be challenged. I learn and grow just like everyone else. So while autism is a lifelong condition, something I was born with, something that will always be a part of me, I'm constantly finding new and better ways to manage life and the challenges of it. I am more and more myself each day. Autism is not a disease or a psychological issue. Therefore, you can't cure it any more than you can cure being tall or having long arms. That said, autism commonly has co-occurring conditions which may require their own treatment. The message here, though, is that I am not a broken neurotypical person. I am autistic. It's how my brain is wired, it's weaved through every aspect of my personality, and it makes me who I am. Some everyday tasks are difficult or even impossible for me, but there are so many things that I can do that you can't do. So why am I the one with the disability? The answer is simple, because there's more of you and only one of me. Of course I want friends, just not on your terms. Not if it means I'm not allowed to be myself and I can't do the things I like to do. I want friends who will let me be me and love me for it. Being different is not always easy. I get bullied, I get picked last, I get left out, I get asked to leave groups because I'm not a good fit. I can't be like everyone else, even if I wanted to, and it's easy to get very angry at an unfair world. But you can make a big difference. Talk to me, interact with me, let me join in, or let me sit on the sidelines without joining in. Invite me without the pressure to say yes. Don't expect me to be normal, just let me be me and don't ask me to leave. To make the world a better place for autistic people, don't force me to fit in, include me while I'm different. I hope you've enjoyed this video and please share this message as part of Autism Acceptance Month.
Yeah, let's back to our slides, our presentation. First of all, physical activity for all kids should be for all kids with or without disability, but including the children with autism spectrum disorder. What we want to provide for all kids, we should provide all of them for children with disabilities or including children with autism spectrum disorder. Because physical activity is important for without disabilities alike, as it promotes healthy lifestyles, especially there are so many benefits doing the physical activities, not just personal, not just the bodies or the physical healthy. At the same time, the social benefits, we can talk about for children with autism spectrum disorder. In the US, United States of America, 16% of children ages between 2 and 19 are overweight, whereas the prevalence of overweight among children with ASD is increased to 19% with an additional 36% at the risk of being overweight. This means more than a half all children with ASD are either overweight or at risk of overweight. Being overweight can put children at increased risk for numerous health problems, both in childhood and as adults, including diabetes, cardiovascular disease, bone and joint problems, and even depression. The effect of this condition may take an even greater toll on individuals with autism in combination with common autism symptoms and some highly comorbid conditions, such as gastrointestinal problems, as well as depression and anxiety. Children with autism generally demonstrate the poor motor skills because they have some social communication problems. So especially some plays, some games, some sports activities, especially with groups, it is not easy for them joining those groups, interact with others. So most of times they prefer to doing something alone, in accordance with their personal interest. But the most of people not joined or not shared their personal interest, maybe. So they do their interest, unfortunately, alone, without any interaction with others. So even the playing or game or other sport activities, the mostly personal or individually completed. This is very negatively affected their social relationship. So there should be some programs, especially providing some interaction, providing show some way to interact with others, especially group activities. So important for their social development, especially they are be part of the society. Consequently, the rehabilitation programs should emphasize the fundamental motor skills and the patterns of movement, individual games and sports, and the developmental activities that increase physical proficiency. An important goal is to have children with autism to develop responses to stimuli in the environment, and reaching to their environment, the surrounding, especially the stimulation and the lots of stimuli are very important for their cognitive or social development. It has been suggested that the decreased physical activity is the primary reason for the increased rate of the overweight in children with autism, while unusual dietary patterns and the use of antipsychotic prescriptions drugs that can lead to weight gain may also contribute. Participation in physical activity may be challenging for individuals with autism because of reasons such as limited motor function and low motivation, difficulty in planning, and difficulty in self-monitoring. Increasing auditory, visual, and tactile stimuli may too improve challenging for affected individuals. Furthermore, physical activity involving social interaction, such as team sports, can present a difficult situation for someone with autism. However, if implemented appropriately, the addition of a physical activity to an autism intervention program can help overcome many of these challenges and improve one's overall quality of life. It is not surprising to discover that physical activity has been shown to improve fitness levels and general motor functions of individuals with autism. A study of a 9-month 3-mile walking program on weight reduction in adolescents with severe autism revealed that the program significantly decreased body mass index among the participants. Additionally, as time progressed through the study, the frequency, duration, speed, and elevation of the treadmill walking all increased, indicating a general rise in exercise capacity and physical fitness. In a study of swimming training and water exercise among children with autism, 10 weeks of hydrotherapy, which include 3 6-minute seasons per week, resulted in significant increases in fitness level, indicated by challenges in balance, speed, agility, strength, flexibility, and endurance. There are so many research to, showing the effectiveness of the physical activity or sport programs on children with autism spectrum disorder. Research, a couple of research, other research also has demonstrated that increased aerobic exercise can significantly decrease the frequency of negative self-stimulating behaviors that are common among individuals with autism, while not decreasing other positive behaviors. Behaviors such as body rocking, spinning, head nodding, hand flipping, object tapping, and light gazing, all of them, the self-stimulating behaviors, the negative behaviors, must be, how can I say, all of them actually needs a specific, behavioral programs, to remove from the children with the autism life. Light gazing, and they have been shown to interfere with positive social behavior and learning, can thus be controlled by use of exercise. This means exercise programs are very effective in decreasing the self-stimulating behaviors of children with autism spectrum disorder. Additionally, exercise can discourage aggressive and self-injurious behaviors while improving attention span. In this study, aerobic exercise included 20 minutes of mildly strenuous jogging. However, the aforementioned swimming and water exercise study also revealed a significant decrease in stereotypical behaviors, whacking, stepping, and the hand clapping, like this. Stereotypical behaviors, unmeaningful, the behavioral movements, repetitive behaviors. I'm talking about that. This exercise program also effectively reduces the stereotypical behaviors. One theory behind these findings is that the highly structured routines and repetitive behaviors involved in running or swimming may be similar and or distract from those self-simulating repetitive behavior associated with autism. This means some exercise, some sports or activities, disciplinal, repetitive sports or activities may help the decreasing the kind of stereotypical behaviors. Because the repetitive behaviors, spinal behaviors, when doing any sports, is acceptable, socially, also individual. But stereotypical behaviors, are unacceptable behaviors. Unfortunately, we define as the negative behavior. Besides improving fitness, motor function, and the behavior in individuals with autism, among the most important advantages of physical activity are the social implication of participating in a sports and exercise. Physical activity can promote self-esteem, increase general level of happiness psychologically, and it can lead to positive social outcomes because interacting with others, really, really important, very beneficial. All highly beneficial outcomes for individuals with autism. All of this, doing the physical activity, especially in a groups, within a group dynamics, really, really beneficial for children with autism spectrum disorder. For those with autism who are able to participate in team sports, like a basketball, like even tennis, the two-person need, or much more person, basketball, football, or other team sports. This presents an opportunity to develop social relationships among teammates and learn how to recognize the social cues required for successful performance on the field or court. However, individuals that prefer individual sports, unfortunately, such as running or swimming, that do not rely as heavily on social cues may still benefit from the positive attributes of physical activities. Yes, even the personal or individual activities, the beneficial, but many times, as I said, physical activity or sport is not just a personal or individual issue. It's a societal, it's the communal issue. So we need to gently force, or I'm not sure is a good word, the force, maybe promote the group dynamics, joining the group dynamics by doing the physical activities or sports, for our kids with autism spectrum disorders, because social ties, be part of the team, interact with others, doing something together, obeying the rules of the sports or the activities, all of things, it's be part of the human life, because we are be part of the society and the living in a communal surrounding, we have people, the surrounding us. In all cases, participating sports provides individual with autism, individual or group activities, very, very beneficial and the positive effect by themselves or their social relationship. While there is evidence to support the role of physical activity in improving autism symptoms, behavior and life outcomes, sports and exercise should not replace proven behavior intervention, but may be effective supplements to these therapies and potentially enhance the benefits. In fact, many of the key components of a successful physical activity program for individuals with autism mirror those that make up some of the most common treatments and behavior intervention. For instance, teaching new skills to children by breaking them down into smaller, organized tasks and then rewarding them for successful achievement is a core component of proven intervention, such as ABA and TEACH. This technique can be readily implemented in teaching physical education to children with autism. Yeah, it's actually, we do some modification, the currently, how can I say, currently using for children with children without disabilities. But if we do some behavior, some modifications, some changing those sport or physical activities, for example, dividing the small pieces, small parts, and teaching the step by steps. If we use the ABA strategies, the teaching any physical activity or sports, we can be successful. They can learn easily, but we need to use the special education strategies, adapted to special education strategies to teaching and physical activities. It's like a combination of physical activities and the special education instruction, delivering it together to children with autism spectrum disorder. Actually, we don't do novel things. Just the key issue is adaptation, behavioral modification, and the following the steps of the ABA. This is increasing interest in establishing program guidelines for enhancing physical activity among individuals with autism. A major reason for this is because research suggests that autism prevalence is increasing and has reached an all-time high. This means that there will be an increasing number of children with autism in schools, physical education classes, and on sports teams. While different individuals with autism may face the different challenges in participating in physical activity, these children should still be given an opportunity to experience the benefits of physical activity. And while the result may vary based on all the available research and that which has been presented in this presentation or paper, the potential behavioral, psychological, emotional, social benefits of physical activity for individuals with autism are numerous and should be further explored. You can see later, you can watch this video, some adapted physical education for children with autism spectrum. Unfortunately, we don't have a time showing here. Many thanks, and maybe you can find some details about this presentation, these two main sources. My presentation is done about the physical activities and dealing with the children with intellectual disability or autism spectrum disorder. I will thank you, all of you. Have a great day.